we all have to face figuring out what the right thing to do and how we get our workforce protected. And so we're going to have a discussion about vaccines today. We're geographically located together, and we want to figure out how we can work with our public partners who are here to support us as well. And we have people from Cook County, from the state, all over that continue to work with us to provide resources for us. And this group was started probably a couple years ago now, and we meet like every other month. I think we have it scheduled for now because of Zoom. We used to meet quarterly, do plant tours and learn from each other. Someday we'll be able to do that again. But it's a way that we can share information and talk about what we have together in terms of, how manufacturers in this area can work together and support each other for common goals and interests. We also have a group that works with and was working with the local high schools and their trade programs, as well as what they need for curriculum to create the workforce of the future that we need. And we had two kind of different growths there. We have a workforce development committee as well as a business to business committee. And sorry, I didn't tell them I'm on the, but I'll ignore that. And so we have these committees that we've worked together, and we'll get those going again. But in the meantime, in the age of COVID, this is our Teams meeting, and we're glad you're here and hope you participate today. And with that, I'm probably going to turn it over to Kindy for you to introduce the speakers.
Great. Thank you so much, Nancy. And again, I appreciate everyone's patience as we're just trying to switch platforms. And so I flashed the agenda, and it was also in the meeting invite. So we have a packed agenda. We have two speakers that will be talking about vaccination, and we'll hear from Susan first and then Scott. Sandra from OAI will give a quick update on the intern match. And then if we have time at the end, but given we're just in a little bit of a time crunch, we'll see how it goes with how many questions we have. Just as Nancy mentioned, just thinking through our standing committees. So with that, I would like to introduce Susan Buchanan. Susan, if you can start sharing your screen if you like. And Susan is a clinical associate professor of environmental and occupational health at UIC. And she's been working with all kinds of both employers and also in practice around public health. And I'm sure we'll have a lot of questions for her. Susan?
Yes, thank you.
Oh, hi.
Hi, I'm not going to use any slides.
Oh, okay, good. That's great.
So everybody can see me, right?
Yes, and if you wanna see Susan without the gallery, if you haven't used Teams before, there's 3 little dots next to her name, and you can just click on that and you can say pin.
But that's okay.
Yeah. If you want.
Little block is fine after had a little champagne last night, I have to say. So yeah, yes. But I'm okay today. Yeah, so I'm really happy to see everybody. And the reason that I didn't use slides is that this vaccine information, most of the work I'm doing is a lot of answering questions from companies, HR directors. What about this? What about that? The technology used for the vaccine is pretty complex, and I don't even understand all of it. So I don't think it's worth making a slide of what's the vaccine and fancy graphics of how it works. But just a little bit about what I've been doing since the beginning of COVID-19. I'm definitely one of those people, along with many, many other people whose workload increased tremendously because this is the area that we work in. And we've been dealing with a lot of companies calling my medical practice group with questions. Our specialty is occupational medicine. So I'm originally a family physician and then pivoted to public health and discovered this new residency, occupational medicine, that has its own board specialty under preventive medicine. And we're based at the School of Public Health at UIC. And it's a specialty of diseases and also public health issues among workers and workplaces, along with the environment. So it's environmental and occupational medicine. So you can see how during COVID-19, this is really like the heyday, the renaissance of our specialty. Now that everybody knows what PPE and N95s are, we're like, yay, that's our maybe our field will finally get some attention. So answering lots and lots of questions. It's been very stimulating professionally, especially because for most of these questions, there are not black and white answers. So we've been trying to stay on top of the literature, stay on top of CDC and international trends. I belong to a international listserv of occupational health and safety professionals where we can throw up questions onto the international listserv and see how people answer. And I've used that several times in the last 10 months, mainly around testing for workplaces, because I work with several international corporations who have questions, as you can imagine. Should we be testing our workers? What tests should we use? How often? And who do we put on quarantine and when? And I'll put questions up on this international listserv. And every time I've put it up, I have been very much reassured by the fact that nobody has the answer. And people are saying, well, we tried this, try that. So a lot of the questions are based on consensus. And so I'm just throwing that out there, that a lot of the information, as you know, is changing rapidly. And there's still a lot we don't know about this virus, and then a lot we don't know about the vaccine. And so we're kind of saying that a lot. Don't know yet, don't know yet. So regarding the vaccines, as you know, there are currently 2 that are approved for use in the US. There are 3 approved for use in Europe. The 2 that have been approved so far in the US are both the same technology. They're very, very similar vaccines, and they use this new mRNA technology. So the Moderna is approved for use in over 18-year-olds, and it's given 2 shots 4 weeks apart. The Pfizer is approved for use in over 16-year-olds and is 2 shots given 3 weeks apart. There are multiple vaccines in their phase 2 trials around the globe. And one of the tenets that I have found interesting from the global public health perspective is this enthusiasm about making lots of different companies making vaccines, because we're going to need so many vaccines to vaccinate the entire globe. So it's great that all these companies are vying and making vaccine. I had originally thought, oh, which company is going to be the one and going to make all this money? But it's not that way. It's really, when you get a vaccine, get the one that's available and is offered to you. It's really not going to be a choice. It's just going to be a lot of different vaccines. Now let's talk a little bit, and I've received both of them. So I'm very happy that I received them. Let's talk about how safe they are. Both of the types that have been approved by the FDA right now have about around 95% efficacy, which is better than many other vaccines. So when I've attended these webinars by the National Institutes of Health or CDC, the scientists that are working on these have all been just astounded at how successful this vaccine has been, these vaccines, and how few side effects they have. So that's really the global picture. One of these lectures I went to just basically said it's like astonishing, used the words astonishing, miraculous, that they work so well and have such a safety profile. So for that reason, we should have a lot of confidence in these vaccines. When it's 95%, though, it does mean that 1 out of 20 people after they receive the vaccine is not going to react. Their immunity is not going to develop. So that's one of the reasons for needing to continue to do the masking and distancing, even if you've had the vaccine. The other reason is there are some major unknowns about this vaccine. One is they don't know how long the immunity lasts, because there just wasn't enough time to study it. I mean, it's really incredible that we have a vaccine 10 months or 9 months after the first ever appearance of the virus. So they don't know how long the immunity lasts. It's probably going to be at least a year. It just hasn't been a year yet for us to see. So probably at least a year. They also don't know if you can still transmit the virus even though you've had the vaccine. Now, this one doesn't make a lot of sense to me from a physiologic perspective. if you have your immune system able to kill the virus, then it shouldn't be able to live in your nasopharynx. But I think the reason that they won't come out and say this is because they don't have the proof yet. But physiologically, it makes sense that you wouldn't be able to transmit it. But that's the other reason for needing to continue the masking and distancing, even if you've received the vaccine. Can I go to the grocery store, have somebody cough on me, and then I have it somehow in my nasopharynx and my immune system doesn't kill it, and then I go cough on someone else? But like I said, there's so much they don't know yet that I think they're just not willing to come out and say it can't be transmitted. The next thing I want to just briefly touch on is the side effect. Not briefly, it's a major question, of course, is the side effects. The side effects are very minimal compared to other vaccines, which actually have pieces of live virus in them, like the measles vaccine, like chickenpox. Those are both live vaccines that you can, there's actually a risk of you getting the disease after you receive the measles, mumps, rubella, and the chickenpox vaccines. With this one, there is no risk that you can get COVID-19. Also, there haven't been any deaths directly attributable to this vaccine. The most severe effects they have found are these allergic reactions in people who have had severe allergic reactions to some type of injectable medicine or vaccine in the past. These are people that already carry an EpiPen, and so they used their EpiPen and they either recovered or some, I think there were a couple hospitalizations, but there haven't been any deaths, for example, from, it caused liver failure or kidney failure or some horrible organ failure. So none of that. 80% or 85% of people will have some type of mild side effect. So definitely soreness of the arm. It's kind of like a tetanus shot. It's one of those, it's a painful vaccine. So a couple days of soreness. And then there is the possibility of low-grade fever, aches and chills, fatigue, maybe mild headache and diarrhea. So a lot of people are having that, especially after the second vaccine. So from your perspective, some workplaces are worried about giving everybody the vaccine at the same time because the next day people might not be able to come in. And that was the experience for me and several colleagues who the day after the second one, you really needed to like hang out in bed and not do a whole lot, take a nap from achiness and fatigue. So there's the thought of staggering the vaccines so you don't have this massive absence the second day. Normally after the second shot. There's still some of that after the first shot, but not as common. And apparently Moderna is a little bit more severe than Pfizer as far as the side effects. A couple other questions, and I do want to leave us time for questions because I know you probably have a lot, but I've worked on some frequently asked questions documents for different companies, and I just want to go through a few of the questions that we're hearing a lot. Of course, how safe is it? I've gone through that. What are the side effects? If I've already had COVID-19, should I get the vaccine? So now we're getting to the point where more and more people have had this vaccine. Do they need to get, have had COVID-19? We're up to about 5% of the population. Should those people get vaccinated? What we're saying for now is absolutely. Because of these unknowns that we still have around the infection is how long are you immune after you've had the disease? It's thought that getting the vaccine develops better immunity than having the infection. We do think that after the infection, immunity lasts for at least 90 days. So that's the cutoff they're kind of using now. If you've been sick with COVID-19, you are probably not going to get it again for 90 days. And you're not going to give it to anybody else in 90 days. For companies who've been doing routine testing, they remove the people who've had COVID-19 from the testing schedule for 90 days. So if you have somebody who's had COVID-19 and you offer the vaccine and they say, I just had it, they can choose to wait 90 days, or you can put them in the back of the line. They can either volunteer to get to the back of the line, or if you're trying to prioritize your company, you can put them at the back of the line. That is safe. But I kind of feel if you're in a situation where someone is offering you a vaccine, get your arm out there and get the vaccine, get it out of the way. Also, if you're doing routine testing, what do you do about testing people if they've been vaccinated? Once you're vaccinated, are you booted out of the testing program? And what most companies are doing is you're back in the testing program just because 1 out of 20, it's 95% effective. So 1 out of 20 people isn't going to develop immunity. We're putting people back in the testing program. Medical reasons not to get vaccines. Okay, we get lots of questions. Workers, for whatever reason, are hesitant to get the vaccine. They're going to come to HR departments and say, I don't want the vaccine, similar to what they did about masking, which we can also talk about if you want. There are very few reasons why people can't wear masks. There really is only one reason why somebody medically can't get a vaccine, and that is if they have had a severe reaction to a component of this vaccine in the past. That means, have they ever had an mRNA vaccine for which they've had a severe reaction? Now, once I read that rule, I'm like, how are doctors supposed to know? We don't know what the mRNA vaccine. So I looked it up, and apparently there aren't any vaccines. They're only in investigations. So you would have had to have been part of a study. This technology is being looked at for HIV. They've been trying it for years to make an HIV vaccine. So the technology has been out there for 20 years under investigation, hasn't been successful for HIV and a couple other diseases like rabies, I think. So someone would have had to have been part of an mRNA vaccine trial. There are 2 chemicals in this vaccine, polyethylene glycol, called PEG, and polysorbate, which those are the 2 chemicals apparently that are causing these anaphylaxis, these severe allergic reactions. And I was a part of a big webinar given by these, high ups at CDC. And they told, they threw that out there. Oh, if people have had reactions to PEG or polysorbate in vaccines, they shouldn't get this. And someone said, well, how do we know, could you please give us a list of the vaccines that have PEG and polysorbate? And they said, oh, we'll take that up to our superiors. So I've yet to see it. But it's on the questionnaire for the person to fill out before their vaccine. Have you ever had a reaction to PEG and polysorbate? So that's the only medical reason. So we're getting questions from people who are currently getting chemotherapy. They are currently immunocompromised for whatever reason. Even people with, severe rheumatoid arthritis are taking immunocompromising medicines. People on prednisone for allergies. All those pregnant people, they can all get vaccinated. They all should get vaccinated, because their conditions put them at risk of really severe COVID-19 infection. So their risk of COVID-19 infection is much higher than this risk of an allergic reaction to the vaccine. Socially distance and masking after the vaccine, I've covered that. And then the last kind of risk question I want to answer is, people might ask, what's the difference in risk between not getting the vaccine and getting the vaccine? I mean, people really are concerned about the risk from the vaccine, especially when the media is just all over this. And there really have been only a handful of these severe allergic reactions compared to the millions who've now been vaccinated. So the rate of these allergic reactions is really, really low. So if you want to compare the risk, for example, with the flu. So the flu, the COVID-19 infection is 10 times more deadly than the flu infection. So we're talking about your risk of dying if you get COVID-19 is much higher. For example, the flu in the US kills 30 to 50,000 people a year. It's still a lot. Remember at the beginning, people were saying, oh, this is not going to be different than the flu, 30 to 50,000 people. As everyone knows, we're now over 400,000 people. And that equates to more than 1 in 900 people in the US have died of COVID-19. It's now the #1 cause of death in the US in the past year. So very much more deadly disease. the chance of dying of COVID once you've individually contracted it, there's actually a big range between 0.25% to 10%. In April, the fatality rate was 6%. So it was a high fatality rate. It's now below 2%, but really depends on age and underlying medical conditions, access to quality health care. So on the other hand, this risk of receiving the vaccine is really, really low. You do have a risk. You probably will get some type of low-grade fever, headache, and fatigue for 1 day afterwards. And like I said before, no one's died from a direct effect of the vaccine. This handful of people have had severe respiratory reactions, given the EpiPen, and they recover. So that's the last thing I'm going to address right now, so that we can hear the next presentation and then open it up to even more questions, if that's okay.
Great. Thank you so much, Susan. So for everyone, I'm sorry, I forgot to say this, but if you have questions, just put them in the chat box. If you're new to Teams, it looks just like a little call out box so that you would see from a cartoon. And we already have a couple in there. But for now, and then I'll call on all raised hands after we hear from Scott. Are you ready, Scott?
I am. Let me share my
Great.
screen here. Hold on. Oops. 1 second.
So Scott is a officer in the employment and labor practice of Greensfelder, and he is also going to be giving some presentations coming up with IMEC. So we can talk a little bit about that because and Scott, we see your split screen. So maybe
let's see.
I think that one that's the dotted, the one that's the icon that's below your active slide. Yeah. And then
This one?
Let's see if that's going to do it.
No.
So if you go to your slide, go back to where you just were, your split screen. I think if you go to that screen that has a slash through it, go back to where you were. Yep. Yeah. Sorry. And then go see below your green slide.
Yeah.
See that one? I wonder if that will do it. No.
Huh.
Maybe the one next to it. Sorry, we did practice this one. No.
I think, Kindy, I think if he goes back here and then just goes into slideshow on his computer, I think it will take us there.
Maybe display settings.
Let me try one more thing here.
Okay. Perfect.
Okay.
Great. Thank you, Scott.
Okay, good.
Floor is yours.
Technical difficulties, as always. So good morning, everybody. Thanks for joining us. Susan, thanks for that presentation. A lot of helpful information there from a medical perspective, and I'll be talking today from a legal perspective. I do have some maybe different viewpoints than Susan regarding how we view an employee who comes to you and says, I have a disability-related disability that would exempt me, for example, from the company's mandatory COVID policy. It certainly, from a legal perspective, we have to view that differently. And as an employer, you need to view that differently because certainly a doctor, to the extent an employee provides any type of medical documentation from his or her doctor, that's what we have to go on. And there's certainly a definition under the ADA as to what constitutes a disability. So we'll talk about that as well. But let's get started. So the vaccine is here. A round of applause for that. Now, of course, the question here that all employers are asking, or you should be asking, can you as a private employer require your employees to get the vaccine. And the important part here is once it is available, right? So for manufacturers, we know that you fall under phase 1B under Illinois. We know that it's going to be available, I believe, on the 25th in terms of for most manufacturers. So you should start asking yourself that question, are we going to require it, right? And the answer is, can you? Generally, yes, and I qualify that, and we'll talk about why I qualify that. So generally, yes, you can. Private employers, you can require that your employees receive that COVID vaccine, again, once it is available, as a condition of returning to work or as a condition of remaining employed in the workplace, subject to two exceptions. There is EEOC guidance on this particular issue. This is a link to that guidance. If you were to just to do a search term in Google for EEOC guidance on the vaccine, you're going to get this link. It is quite a lengthy guidance, but if you go to section K, as in Kathy with a K, that's the EEOC's guidance on this particular issue. But again, the answer here is yes, you can require it subject to two exceptions. So let's talk about in terms of when we're going to get it, right? When does it become available? Because that's the trigger point from when you can, if you choose to do so, make it mandatory for your employment staff. So we're currently in phase 1A. We know that phase 1B is going to be in some counties, I believe it has started already, but generally speaking, according to Governor Pritzker, 1B, that phase is set to begin, I believe, January 25th. And so who's covered under 1B? Frontline essential workers. Frontline essential workers, amongst the many definitions of those included under there are manufacturers. And for manufacturers, that's defined as production of goods for retail, wholesale, or other manufacturers, right? So for all manufacturers, the vaccine is going to be at least available to your employees beginning relatively soon here. And then phase 1C, in terms of who's next, and they have possible groups included here, because that's what the Illinois Department of Public Health has stated, right? They have yet to adopt CDC's definition of phase 1C. In fact, Illinois varied in terms of who they included in phase 1B from CDC. CDC's phase 1B was individuals, frontline essential workers, and individuals who I believe are 75 or older. Illinois lowered that to 65 or older. So that's what we have here in terms of who are possible groups under 1C, 16 to 64 with high-risk medical conditions and other essential workers. Again, yet to be formally adopted and or formalized by Illinois. And then phase 2 essentially is everybody else. All right, so what are the two legal exceptions to the extent you do as an employer want to have or implement a mandatory vaccination policy, right? The first is an employee who states, I cannot take the vaccine due to a medical disability. The second is employees who are going to tell you I'm seeking or I want an exemption based on my sincerely held religious belief. And let's go through these in detail so you have an understanding of how you should address these claims or requests from your employees to the extent you implement a mandatory policy, right? So the scenario, the employee says, I can't get the COVID vaccine because I have a disability that makes it unsafe for me to take it. Well, we heard from Susan that really there's only, at least from her perspective, one essentially not necessarily disability, but this side effect from a severe allergic reaction. Now, is that the only disability that an employee may conjure to try to get out of your mandatory vaccination policy? We don't know, right? So what happens though when an employee does state, I have a disability, I want an exemption from your policy? First thing is ADA is implicated, right? The Americans with Disabilities Act. So we need to know how the ADA defines disability. A disability is defined as any physical or mental impairment that substantially limits one or more major life activities of an individual. So what we have at our disposal here to avoid abuse from an employee who just simply doesn't want to get the vaccine is we can require that individual to provide us with medical documentation supporting his or her claim that he or she has a disability. Right? So we tell the employee, I understand you're requesting an exemption from our mandatory vaccination policy. The particular exemption is due to your claim of disability. We're requiring you to provide us with medical documentation from your healthcare provider to support the claim for your reasonable accommodation. Right? And that's what this is. The employee is asking for a reasonable accommodation in the form of an exemption from your mandatory vaccine policy. And at the end of the day, right, it's going to depend on what that medical documentation says, right, in terms of from that individual's healthcare provider. And what we've seen so far is basically a lot of insufficient information, right? We've seen these records, or at least notes from the doctor saying, Scott has a medical condition, does not disclose it, and he needs an exemption from the policy. Not good enough, right? Not good enough at all. There's a way we address these claims that unfortunately for purposes of this webinar, we don't have time to really go over, but essentially you ask for additional information, because if you get a note like that, that provides us with no information. How are we to determine, first of all, if the medical condition is a disability? We can't, right? Because the doctor has told us Scott has a medical condition. How do we know whether or not there is a need to accommodate? How do we know whether or not there are any accommodations that can mitigate the effect of the vaccine other than simply an exemption from the mandatory vaccine policy? We don't know. We need answers to those questions. You can request that from the employee to get that information from the doctor. So to the extent, let's say, that we do make a determination based on medical documentation that the individual does in fact have a disability as defined under the ADA, right? And this disability would render that individual at least initially eligible for the exemption from our COVID-19 policy. So that's step number one. Step number two is we make a determination before we actually provide that exemption, and before we have an obligation to provide that exemption, is if we do in fact exempt Scott from our mandatory COVID policy, does Scott pose a direct threat to the safety of others in the workplace? He's going to be the only one who doesn't have the vaccine, right? Now, fortunately, the EEOC has already stated back in March that COVID-19 in and of itself constitutes a direct threat. So they've done the legwork for us in terms of making that determination, right? So the first determination is, does Scott have a disability? Again, yes or no, depending on the medical documentation. If you say yes, right, then we have to determine, does Scott, if we provide him with this exemption, the accommodation he's requesting, does he pose a direct threat? Right? And there's an easy argument for us to make that, yes, an unvaccinated person certainly still poses a direct threat in the workplace. Now, I may respond to that and say, hold on a second, right? How am I a direct threat today, but I wasn't a direct threat yesterday? I'm wearing a mask, right? I'm following all social distance guidelines, right? A legitimate question that an employee likely will ask. Certainly we're not going to go through each of these steps with the employee and tell them, well, Scott, we believe you to be a direct threat. But we have to be ready to address that question, right? And the question is, even with the masks, right? Even with the mask, that doesn't necessarily mean that you can't contract the virus, that you can't give the virus, right? We know that already. So there's certainly responses to that. But for purposes of this discussion, we can say, Scott, you are a direct threat. Now, does this mean that you can automatically, if you choose to do so, exclude me from the workplace? Does it mean you can terminate me? And I've had that question where employers are saying, all right, Scott doesn't want the vaccine. We believe he's a direct threat. Can we get rid of him, right? Can we just physically exclude him from the workplace until we believe, right, that there's a safe time for him to return? And the answer is no, not just yet. At some point we can, not just yet. So what do we need to do then? We need to engage in what's called the interactive process. And the interactive process is a phrase that is used under the Americans with Disabilities Act to determine whether there is a reasonable accommodation And in this situation, the reasonable accommodation is such that would eliminate or reduce the risk of me, an unvaccinated employee, posing a direct threat to the workplace. What are some potential accommodations that may eliminate or reduce? Now, this isn't a laundry list. These are just certainly some suggestions that my clients have been implementing in terms of possibilities that may reduce or eliminate me being a direct threat to others in the workplace. Well, if my position and duties permit, and this is important, if my physical presence at the work site is not an essential function, you can allow me to continue, or maybe allow me to work remotely. Now, the time period for that is going to be dependent on you, right? When do we establish this herd immunity that may render essentially it safe for me to come back, right? Even though I didn't get vaccinated. So that's going to be a consideration you have to think about. And some employees, quite frankly, are abusing this, right? They just want to work from home all the time and never want to work, never want to come back to the office. And that in and of itself is not a reasonable accommodation, just so you know, but that's for another webinar. An indefinite working from home is not a reasonable accommodation. So what if we can't exclude someone from the workplace, right? A machine operator. Well, Scott can't take the machine home with him, so we need him to come to work. We make widgets. Scott works the machine that makes those widgets, right? Require him to come to work. He's got to continue. I've got to continue social distancing, wearing masks. Susan already provided the kind of empirical data for why that needs to continue happening, right? And the question I'm getting is, we can continue to require me to do this even after, let's say hypothetically in September, right? I'm just throwing a month out there, I have no idea, but Fauci and Illinois Department of Public Health lift the mask requirement. They've got the data they need, say, hey, it's now safe for those people who've gotten the vaccine. They don't have to wear masks anymore. They don't have to continue to socially distance, right? We can continue as an employer to require those employees who have not gotten the vaccine to continue wearing a mask, to continue social distancing, right? Because again, they didn't get the vaccine, so they can still transmit it to other employees. So keep that in mind. We can shift unvaccinated workers to other workplace roles, again, where they have less contact with others. Again, very case-by-case determination, depending on your workforce. We can relocate work sites within a building. Again, this is all going to be dependent on your particular company, the individual's position, the individual's job duties. These are certainly just some suggestions. Okay, so what if we determine now, when we've gone through that interactive process, that we cannot reduce the risk of to an acceptable level of me potentially transmitting the virus to others in the workplace, so I still constitute a direct threat? Can you then, if you want, physically exclude me from the workplace? Yes, right? We've gone through all the necessary steps. Does this mean that you can automatically terminate me? Not just yet. Keep in mind that there's other statutes and other rights that you have to address prior to telling me, Scott, you're going to be terminated because you can't you've told us that you can't get the vaccine. We've gone through an interactive process. We can't reduce or eliminate this risk of you transmitting the virus. What are some of the other statutes you have to keep in mind? Well, first and foremost is FMLA, if you have 50 or more employees, right? And how does FMLA factor in this? Well, maybe my disability constitutes a serious health condition. And if my disability constitutes a serious health condition under the FMLA, what does that mean? That you're required to provide me with unpaid or paid FMLA. I say paid because depending on your company, you may require me to take paid leave simultaneously with FMLA. Now, I may say as an employee, listen, I don't want to go on FMLA, right? Doesn't matter, right? If I meet the requirements of a serious health condition, you have to provide it me. You have an affirmative duty. Now, what if you say, but Scott, listen, why are we delaying the inevitable? We know we're going to terminate this employee. The disability is a permanent condition. Nothing is going to change between now and 3 months, right? The 12 weeks. Doesn't matter. You have an affirmative obligation to provide me with FMLA, one, even if the employee doesn't want to, And more importantly, too, even if you come to some handshake agreement with the employees, say, listen, let's not delay the inevitable here. Why don't you just leave today? You have a duty to provide me with FMLA leave. Otherwise, you're going to subject yourself to an FMLA interference claim. Make sure throughout this whole process, you are documenting and providing sufficient support for the decisions you've made, because inevitably you will be sued. I can tell you that. And what is the best defense to any type of lawsuit is documentation showing your legitimate business need and reasons for each of the steps that we just discussed. All right, so the second exemption here, which I think has the most prone to be abused by employees, is the religious exemption, right? So the scenario is, I tell you I can't get the vaccine based on my sincerely held religious belief, which prohibits vaccination. So in essence, I'm telling you I belong to a church or some religious group, and that we rely on faith-based healing, right? We don't believe in vaccinations. So similar analysis that we just went through with the medical exemption. Unfortunately, our power and our authority here is very limited. We don't have the scope of the authority to delve into whether or not someone has a sincerely held religious belief like we do with a disability. The EEOC permits us to make a very, very limited inquiry into whether or not something in fact is sincerely held or whether or not something is religious. So it is a very, very low threshold for employees to meet. And I'd be shocked and haven't seen in my 21 years in practicing employment law where an employee has not met this belief, unless you can show that they literally got it out of a Cracker Jack box. But how does employee meet this threshold? Very easily. One, they provide and simply can print something off the internet saying, here's my religious belief, printed this off the internet. It shows that we only rely on faith-based healing. They've met that prong, right? I can verbally tell you this. I can say, employer, well, I attended service on Sunday, and the pastor or head of our religious group said that we only rely on faith-based healing. I've met that. I can provide you with an email, right? Or just a document from, again, my pastor or the head of my religious group saying we only rely on, we only believe in faith-based healing. I have met that particular threshold. So again, it's very easy for an employee to meet that. Now, one thing to keep in mind here is there is a distinction with a difference between a sincerely held religious belief and someone who says, well, listen, Trump's not getting the vaccine, so I'm not getting it. Or, well, I just read some article online and what I think was a medical journal, and they said that the vaccine's not effective, so I'm not going to get it. Or someone saying, listen, the Cruz household, we're not getting the vaccine. We've made a decision as a family, we're not getting it. We have no legal obligation to accommodate those ideas, right? So to the extent you are mandating, you want to implement a mandatory vaccine policy, if I tell you the reason I don't want to get it is political, scientific, personal, you can exclude me from the workplace on the spot. You can terminate me on the spot because we have no obligation to accommodate those beliefs, quote unquote. Okay, so Susan already went through this, so I don't want to spend a lot of time, but should you offer and can you require employees to get the vaccine who already have COVID or they've had COVID? The answer is yes, we can require. Susan provided the data in terms of why, because we know that employees can still potentially get the get COVID. Again, there's that 90-day period that Susan talked about. So to the extent you have an employee who says, hold on, I don't want to get the vaccine. I already had COVID, so I want that exemption. No, you can still require them. And my advice, kind of like what Susan said, you can put them at the end of the line or say, for a period of 90 days from the date that you got over COVID, after that 90-day period, we're going to require you to get it. Right? Make sure you are uniformly applying that policy. If you choose to implement that, it's when we start making exceptions, particularly amongst people who don't look like each other, that you get yourself in trouble with discrimination claims. Susan went through this as well. Should there be a need to continue requiring people to wear PPE, social distance, even after they've got the vaccine? And the answer is yes. Because again, there's not, we don't know for sure how, in terms of, how long your immunity is going to last for, and several other reasons, that Susan brought up. So yes, you can. So the question I get is, should our mandatory vaccination policy supplement or replace our mask social distancing requirement? It supplement. It certainly does not replace it. Folks should still continue wearing PPE and doing social distancing. Can you require proof, right? If you're not doing it on site, and most employers are not because you don't have a medical director on site, how do we know whether or not Scott actually got the vaccine, right? Well, you require proof. And can you do so? Yes, the EOC gave us the green light in that guidance that I spoke about earlier today with that link. So you can require individuals to provide proof of receipt of a COVID-19 vaccine, but make sure to tell them all you want in that proof is the fact that I got it and the date that I got it. We don't want any other medical information as part of that proof that substantiates the medical documentation, because once we get other medical information relating to other conditions or things of that nature, ADA gets implicated. And at the end of the day, all we want to know is, Scott, did you get it? And if so, when did you get it? It's all the information you need. Legal considerations here, there's just three. But I'll go through these very quickly. So first is, how are you going to, if in fact you're going to mandate this, make sure it's an equal application of the policy, right? So you need to determine what segment of our workforce are we going to require. I've got some clients who are saying only folks in the manufacturing shop, on the shop floor, right? The manufacturing floor, we're going to require, because our office employees are working from home. So we're not necessarily worried about that. I've got other employers saying, or other clients saying, it is a mandatory policy across the board. Everybody's getting it, right? So again, this depends on your company, how you want to certainly address this particular question. But with every other application of any policy, make sure you're doing it uniformly. Again, when you start making exceptions, that's when you get yourself in trouble. So workers' comp. Side effects from the vaccine. Now, Susan talked about there's one potential side effect. There could be others we don't know yet, but the issue here is someone's going to say, to the extent it is a severe side effect, right, that renders someone incapable of working maybe for an extended period of time. And there's potentially, the allergic side effects, but maybe there's some other side effect to an underlying medical condition that's triggered from the vaccine. The question here is, if we require this, is that something that an employee can file a workers' comp claim, and or is that a compensable workers' comp claim? The answer is, to the first part, is yes. Employees can always file a claim for workers' comp. Is it, if you require that, if you have a mandatory vaccine policy, is this something that is going to be a compensable workers' comp claim? The answer is likely yes, and good. You want it to be, right? Because that means you have insurance that's covering this. That means that an employee can't go to the Daily Center here or to one of the other state courts and file a lawsuit against you. Because if it is a workplace-related injury, and it would be, particularly if you're mandating that you get the vaccine, right? My argument there is an employee would say, well, the only reason I got the vaccine is you made it a requirement, thus a term and condition of employment. So the side effect I got from the vaccine, right, we can tie back to the workplace, i.e. your mandatory policy. And again, from my perspective, that's a good thing, because you have insurance to cover that. You don't want someone filing a claim in state court against this. So the other last consideration here under the National Labor Relations Act, remember, employees have a right to engage in what's called protected concerted activity. What could be examples of that? Well, let's say you don't implement a mandatory policy, right? And let's say I go on social media or Twitter today and I bash you for that. Right? I say, I can't believe that company, my company, and this is who they are. They have not implemented a mandatory vaccination policy. They don't care about the health and safety of us as employees. Of course, that's going to make you mad. You're going to want to discipline that employee. If you do, you're going to get in trouble, right? That's protected concerted activity, because the individual is talking about terms and conditions of employment, i.e. safety in the workplace. So be very careful about that. Again, that's a completely separate webinar in and of itself. Lastly, if you're a unionized workforce, do you have a duty to bargain with the union over the implementation of a mandatory COVID vaccine policy? And the answer is likely yes. Why? Because if it's a mandatory, that means that I could be fired or disciplined for this, right? And the union's not going to like that. Now, that being said, what my recommendation to you is look at your management rights clause in the CBA to determine whether or not how general or broad your power and authorities are, such that can you articulate a reason based on that management rights clause, whether that gives you unilateral authority to implement a mandatory vaccine policy. Unlikely, and more to the point, unless you recently negotiated a new CBA in the past couple weeks, vaccines weren't likely on your mind when you negotiated your, the CBA with the union. So more likely than not, you do have a duty to bargain with the union. Even if you think you don't, I'd still give the union a heads up because they're not going to be, they're going to have questions and likely raise hell with this as well. Hopefully they don't, but you never know. All right. So that terminates. See what's on my mind. So that concludes the at least my portion of the webinar. Happy to take any questions that folks may have. And here's my contact information. If you don't get a chance to ask me a question about something I said, I'm happy to try to answer it after.
Great. Thanks, Scott. And we'll open it up for questions in 1 second. I also just wanted to point out IMAC is hosting Scott for a much longer detailed conversation on February 11th for an hour and a half, which will be a more comprehensive, it's on my screen. And so another chance for either you or your colleagues and others to hear this. We're also recording this, and Scott has also agreed to share his slides. Okay. With that, we've been having some just conversations in the chat, and so the first is Sal asked a question: can implementation of a vaccine policy be different for current employees versus new employees, i.e. not yet hired?
So the answer to that question is yes, and you have to think of it in 3 phases, right? So the first phase is I apply for a job, right? I submit an application, and employers are asking me, can you require Scott, when he submits the application, to provide us with proof that he got a COVID test or that he has no symptoms? And the answer is no, you cannot do that at that juncture. What the EEOC has said and what the law is that those are medical inquiries. And the only permissible medical inquiry pre-onboarding is after you've given me a conditional offer of employment, right? So, the letter you send out to say, that tells the applicant, we're going to conditionally offer you employment. You have to go get a drug test. You have to go, you're subject to a credit check, or not a credit check, a background check. It's after you've provided me with that conditional offer of employment, that's when you can ask me or require me, ask me whether or not I've got any symptoms, whether or not I had COVID. And at that point, you can require me, if you have a mandatory policy, to go get tested. And of course, on day 1, right, when I walk into the facility, then I'm subject to the same policy that everybody else is. And so that's how you have to look at it, kind of 3 phases. Pre-conditional offer of employment, you can't ask, you can't require. Conditional offer of employment, you can ask, you can require, and then certainly day 1, I'm subject to the same policy everybody else is.
The next question, thank you, Scott, is any thoughts about paying incentives to employees to take the vaccine?
So I've got clients who are doing that, and Susan raised a good point during her webinar. The reason is, after you get the vaccine, you're going to have some, potential drowsiness. And she talked about, she even said, the next day she was kind of, unable to really, I don't want to put words in your mouth, but the next day there were still some issues there, right? So what my clients are doing, we've recommended, at least if you aren't making it mandatory and you want to kind of dangle that carrot, right, is you provide paid leave. So you tell employees that if you get the vaccine, right, we're going to give you, 1 day of paid leave off after the first shot and then after the second shot, right? Some of my clients are offering gift card. Again, these aren't ones who are doing the mandatory policy. They've just done it doing voluntary. They're giving gift cards to employees. So yes, you can certainly incentivize. And someone asked me, but it seems like you're bribing employees. Is that legal? And the answer is yes, of course it is. We're not bribing employees. What we're doing is offering them an incentive, right? It's no different than any other incentive programs that you may have in the workplace for your employees to meet a certain metric. This is just in a different context. So again, you have options available to you, and yes, you are bribing your employees. And in this context, it is legal to do so.
Great. We have a hand up from NM. I'm not sure who that is. NM. Okay. So those are all the questions in the chat. Does anyone else have, the floor is open. Oh, are there concerns about if we survey our employees now to see who's willing to take the vaccine when it becomes available? This would also be for planning purposes and also to assess risk of continued exposure. So current concerns about distributing a survey to see who would be willing and not willing to take it.
The concern here is if it's not anonymous, right? Because what you're doing otherwise, you're asking employees to disclose to you and not voluntarily, because you're asking for it, potentially underlying medical conditions and or disabilities that would render them unable or unwilling to take the vaccine. So to the extent it is an anonymous survey and that you can't tie me to a particular answer, then there isn't a concern. So I'd be very careful with that. And then also very careful with who's reviewing those, right? That should be something that HR reviews, because again, it's really going to be dependent on the questions you're asking. I would certainly have legal counsel review that survey before you do implement it to make sure you're not asking any medical type questions that could give rise to obligations under the ADA, that could disclose someone's medical condition to you. And then of course, who's going to be reviewing those surveys, right? Because there is potential medical information there. Someone may know, oh, Scott has this condition, this must be Scott then. That's not good, right? So it's got to be anonymous, and you got to be very careful with the type of questions you're asking.
Can I ask a question? That was me who asked that.
Yes, Lilia.
Scott, so if we don't survey, and we as a company, we're planning to offer the vaccine on a voluntary basis. If they want it, they can have it. We're partnering up with Walgreens to do this, as we do with the flu vaccine every year. So if we don't survey, are we able to ask after the fact, after the vaccine has been offered, and let's say we have 100 people who accepted it, are we able to ask Walgreens, can you tell us who accepted the vaccine, who was vaccinated and who was not?
Yes, you can.
Okay.
Or you can say we did.
So it depends on, I would say this, you're asking for medical information. And in that situation, what you can ask, not necessarily Walgreens, what my client has done in your situation is, so they're not mandating it, but they're making it voluntary, just like you are. But what they've done is they've made a mandatory condition to that voluntary aspect. And what they've said is that, hey, we're not mandating it, requiring it, but if you do get it, right, then provide us with proof that you have gotten it, because we want to know for purposes of safety in the workplace, and that's what you have to tie it to, because it is, we want to know who got it and who didn't get it, right? Because again, there may be a time when Fauci and Illinois Department of Public Health lift the requirement of the mask, and we want to be able to know who we're still going to require to wear a mask and who's not. So you have to tie it to, just like with everything we've talked about with under the medical portion, a legitimate business reason, right? You can't just say, well, we're just curious, because you're in violation of the ADA then. And so to the extent you tie it to a legitimate business reason, which there is, right, COVID and transmitting it in the workplace, then you can do so, but you got to document that, and you have to make sure employees are aware of that. And also With Walgreens, again, I don't know what information they can provide, and they may not even without a release from the employee. So, even though you're partnering with them, because I've had situations, for example, where I've asked for information from my client's work comp carrier, and they're not even giving it to me, and I'm the lawyer for the company because they want a release from the employee. So you need to be careful about that, where I can certainly see Walgreens saying, because they're subject to HIPAA, right? And they can't disclose that information without a HIPAA release. And if they do, they're in big trouble. So, you have to talk to Walgreens about that first, because Walgreens are going to say, listen, we can't give it to you unless Scott, in fact, signed a release that allows us to give him that, give you that information. So that's a whole other can of worms that you have to think about.
Scott, this is Nancy. If I can, I'm sorry, Lilia, were you?
I'm done. Thank you, Scott.
All right. So I was on another webinar where they talked about the actual asking for proof of receiving both of the vaccines. They have now determined that that is not a medical record, that you can actually get the proof of having a vaccine if that's your company policy. Is that, and I heard you say something slightly different. Did I mishear?
You didn't. So what I said was that you have to ask Walgreens what information they're going to provide you.
I'm not talking about I'm talking directly to the employee. Having the employee provide me proof that they have received both vaccines as part of my, and I am also leaning towards the incentive portion versus the mandatory portion. Which
so like we talked about in the webinar, you can require that your employee provide you proof that they got vaccinated. The EEOC, in their guidance that they issued in late December, was that link. That was one of the questions. The Q&A is, can we require it? The EEOC, yes. But the caveat to that is, and again, as we talked about, the only information you want is, yes, Scott got it, and the date he got it. You don't want any other potential medical information on that proof, because then that triggers a medical inquiry under the ADA. And at the end of the day, all you care about is the fact that I got it anyway. So, you shouldn't ask me for any other information than, yes, Scott Cruz got it. He got it on, January 21st, 2021. Perfect. That's all you need.
All right. And Kindy, I see another question here that goes to Susan. And we are getting some questions about this here too. What are long-term effects? Younger employees are concerned about possible sterilization years later. I know we don't have a lot of long-term data, but how would you address that if you were us?
I would say that even though we don't have the long-term data yet, the way the vaccine works wouldn't physiologically allow that to happen. It's just not the way the vaccine works does not interfere with cells in that way. I mean, I'm not sure if that's helpful, but there really haven't been, I have seen this question before. And one thing I said is that in the history of Western medicine, there have been things that have affected fertility. There have been chemicals that have been devastating, chemicals either that workers were exposed to in plants, or there were medications that had devastating effects. That's never happened with the vaccine, because vaccines don't really work that way. They put something foreign into your body that your own natural reaction, you rely on your own immune system to say, this is foreign. Next time I see it, I'm going to get rid of it. But it's a piece of a virus. I mean, it truly is something foreign. So that's really a totally separate physiologic response than anything having to do with fertility.
Okay. And also, I would say that's great information. I'm trying to think about how I'm going to remember to say that to people.
That's what I was going to ask. Susan, is there an FAQ or something like that someone has put out that employers could give to their, or?
I haven't seen one on that exact question, but I can certainly, as I said, I have other FAQs that I've developed for other companies, and I could send a draft of FAQs and include that one. Let me put that on there right now.
The other one is you're the first person I've heard that encouraged pregnant women to get the vaccine, and everything I've heard before this is it hasn't been tested on pregnant women, so don't take a risk.
I've heard that too. That's just not the official guidance. The official CDC guidance and from maybe WHO, I forget, is just really saying the only reason not to get it is this previous reaction. So it includes pregnancy. Now, because it wasn't studied in pregnancy, one of the caveats they often add is speak to your doctor about it. You know, so that would probably be the safest.
And I'll chime in there too. So we've seen that as well from my clients who we've had pregnant. And that's why I said, you know, under the ADA, you have to go through that analysis, because a doctor, there's, you know, reasonable minds are going to differ on this. And there certainly can be a doctor who says, you know, there is some risk for my patient who's a pregnant female to get the vaccine, and that could constitute a disability, again, depending on what the doctor says in that medical documentation. So that's why it's so important to require that documentation from the employee and to give it a good thorough review to make sure that it meets all of, you know, the information you need to determine whether or not something does in fact constitute a disability, and whether or not you have to accommodate that particular disability.
Scott, this is Craig Kissinger. Can you also talk about, with regard to incentives, the EEOC guidance on restrictions on incentives to be de minimis, so that people don't feel like if for some reason they are missing out? I know there's been a lot of discussion with that just in general with wellness, and I thought specific to incentives relative to encouraging people to be vaccinated.
So, you know, again, in terms of de minimis, there's reasonable minds differ on what that is. Are companies offering $500? No, because they'd go bankrupt. You know, they're offering, you know, a $50 gift card, for example, if they are offering that. But generally what I've seen in terms of incentives is we're going to give you paid time off, because we understand that there may be effects from this, and we want to make sure that you're good to go when you come back in the workplace. And so the biggest incentive that I've seen from my clients is, if you do get it, we will provide you with paid time off. And that in and of itself to employees is going to be a lot more you know, let's say not necessarily lucrative, but a bigger incentive than getting, you know, a $25 gift card from, you know, to Amazon, for example, being able to have a day off, things of that nature, paid time off, where they're not having to use and exhaust their own paid time off. So again, it really, it's different from company to company. But, you know, I haven't seen someone offering, you know, $1,000 per shot you're going to get. It's something very small, $25, $50, but generally speaking, they're offering pay time off, you know, the next day for their employees. And that really is the incentive that employers are offering their employees.
So that was going to be my question. Was it just one day, and is it after each shot? And maybe Susan can talk to, because I know she talked about side effects of fever, headache. How long are those typically lasting, so that employers can develop are they going to grant one day off or multiple days off?
Good question. And so my clients are offering just 1 day of free paid time off per shot. So you're getting essentially two PTO days after each shot.
Mm-hmm.
Yeah, I mean, I've heard the symptoms start between 6 to 10 hours after receiving it, lasting up to 36 to 48. So it could be 2 days. But like I said, after the first shot, most people don't have any symptoms, and it's the second shot. I mean, some people still do, but maybe 2 days would be sufficient between the two shots.
Perfect. Thank you.
Susan, have you heard that reactions are worse in those that have already had COVID?
I have heard that, and we see that sometimes in the immune system. It's called a booster phenomenon, that your immune system ramps up, and then when it gets another, you know, it sees this foreign antigen one more time, it goes even a little, you know, it has a more severe immune reaction. So that would be these same light symptoms, which would be maybe more severe, worse achiness, worse fatigue, maybe worse headache. It still doesn't mean that it causes, any organ dysfunction.
I see. Okay. Well, I just want to thank our panelists, Susan and Scott, for all of their help and information and just their time today. We will follow up with Sandra on the intern match at our next meeting, and then also have a discussion around the committees as well. I didn't want to cut this discussion short. It's very important, we know, to all of our members to understand the current state of vaccinations, and we'll be sending out a summary with all of the details. Scott will be willing to share his PowerPoint. I'll also include a link to the next presentation, and Susan's also been willing to share her information. So all of that will be a part of my follow-up to all of you. Nancy, any parting words before we say goodbye?
Yeah, I guess I would say thank you all for participating. I think this one was a really, really great session, and thank you to Susan and Scott especially. This was very informative. I guess I have a question to the other manufacturers, if you can put it in the chat box before we close off, to share the information. If you've had any luck in being able to secure vaccines for your workforce, can we share that information? Because I haven't had any luck here at this point yet with Class 1B, but I heard somebody say Walgreens and said, hey, we got to check on that. Has anyone else had any luck trying to get the vaccines for their people?
Nancy, this is Craig Kissinger. And I just wanted to say, literally just this morning, I received something from Will County, because that's where the side of the border we're on, a survey from Will County Emergency Management Agency, a survey for businesses that it says after you fill out the survey, somebody will reach out with you for more information and to coordinate vaccination plan for your business. So I'm not sure if Cook County is doing that, but I did just receive that this morning from Will County.
Great. Scott, did you want to add something?
No, I know that the IMA, the Illinois Manufacturers Association, to the extent your members, they've provided guidance to manufacturers on how to sign up to get the vaccine. So to the extent you are members, I can share that as well. I know I forgot the name of the program, whatever it is, but there's a way to sign up, I think, to get on a list, to have that distributed. I believe, without having, I remember there being something like that.
Great. Thank you for that. Thank you, everyone. We appreciate your time, and we'll send a follow-up with all of this information. I appreciate everyone's patience with the technology issues.
And I would add one more thing. Thank you, Kendi, for getting such great speakers for us. Nice work.
Oh, no, it was all the convening members. So I really appreciate the great team of convening members that we have for CMISP, and they've been very helpful. So thank you, everyone. Have a good day.
Nice meeting.
Get vaccinated.
Have a great week.
Bye.